Now, let's make time for a special guest, and we're happy to say a frequent guest on the program, Health and Human Services Secretary Alex Azar. Mr. Secretary, welcome back. It's very good to see you, sir.
Great to see you, Stuart. How are you?
I'm real good, thanks for having you on the show, I got to say. I hear that the administration, under you want to have short-term health plans which offer less coverage but are cheaper, less money. Have I got it right?
Well, what we're doing is bringing more affordable options to individuals who are trapped under the Affordable Care Act with insurance that is actually not affordable or not available or doesn't deliver them hospitals and doctors that they need. So these plans that we're now allowing to be offered under our new rule could save them as much as 50 to 80% off of what they would pay for an Obamacare exchange product. So this could be a really attractive option for millions of people.
So anybody in the private sector who wants this health insurance could just get it. You don't have to belong to some exchange or some club or anything like that.
That's right. Now, this will still be subject to state law. It's putting the regulation of insurance where it belongs under state law. But these can be really attractive options for individuals who are in transition between jobs, who may be gig economy workers, who are independent contractors and don't get an employee insurance, those who are working maybe three part-time jobs and they don't get insurance from any one of them. These can be great options for them, or people who are out there in America who are in any of the 52% of counties in America with just one Obamacare plan that may be too unaffordable to them and not offer them coverage where they live of doctors and hospitals. Again, it's about providing options for people. They may not be right for everybody, and everyone needs to go in with their eyes open, but it's another option the president's delivering to provide affordable insurance for people.
Now, what about getting the price of prescription drugs down? I see you're proposing an open market in drugs. Now, does that mean that foreigners will start to pay the same price that we pay here? In other words, they won't get them cheaper any longer. They'll be the same price as us, so we'll maybe get a break. Is that how it works?
Well, one of the things the president's committed to is ending the foreign free riding off of America's investment in research and development of drugs here, and where we pay all the costs of development and other countries pay much less in their systems because, of course, they have socialist systems that price control. And one of the things that I've done is I've asked our FDA commissioner to figure out how we can import drugs from developed countries where we have no intellectual property on the drug here in the United States, so we're not violating patent rights or any intellectual property or harming innovation, but where we have a single product here in the States and the price is going up radically, so you've got sort of a supply and access disruption. How can we bring competitors in from outside the United States quickly to introduce more of an open market for competition there?
Could you deal with this one quickly? We're getting reports that insurers in many states are looking for and imposing smaller Obamacare premium hikes. Get into that quickly.
That's right. We announced yesterday that the filings that we have seen average to only a 5.4% premium increase. We've got many states with smaller increases than we've gotten used to, and several states that actually have had premium decreases in them. Now, listen, the Affordable Care Act is still broken. It does not work because of its own structure. The premium baseline from which they're operating is entirely too high and unaffordable for so many people. But under President Trump, we've brought stabilization there that at least is bringing some relief to individuals, even if the absolute dollar amount of these plans is unaffordable and even if the benefit packages aren't necessarily what they want. That's why we're still, Stuart, bringing these short-term limited duration plans out there to be affordable. We're making association health plans available. Why we've freed people from the tax, the individual mandate tax, to require them to buy insurance they don't want and can't afford. So that's all what the president's trying to do, is to bring affordable options to people.
Mr. Secretary, if you can give me cheaper health insurance, cheaper prescription drugs and lower premiums, you're the man of the hour. You've done really well.
that would be President Trump doing it, but I'm glad to help execute his agenda.
One last one. I want to read a quote for you from House Minority Leader Nancy Pelosi, and here is that quote. American families are drowning under the weight of stagnant wages, higher health costs, and soaring prescription drug costs. But the GOP continues to pick their pockets to give more handouts to the wealthiest 1%. Sir, would you respond to that?
I'm glad to.
I'm sure you are.
You know, under this president, we're seeing 4.1% GDP growth, given the president's pro-growth agenda, the deregulatory actions of his administration, the tax cuts that he's brought to the American people, the money that's been put in their pockets. We've seen 2 pharmaceutical companies decrease the price of their drugs for the first time that I can ever think of. We've had 6 companies that had planned to do price increases, that they had filed notices they were going to increase drug prices, say they're not going to increase. And we've had 12 drug companies say they're not going to increase prices at least for the rest of this year. And that's all while we're working to make the system more transparent. We're bringing negotiation to drug prices. We're fixing government programs. We're approving a historic level of generic drugs. So I don't get it. I don't get it. President Trump is bringing lower drug prices. He's bringing economic growth, job creation. I don't get the criticism.
Well, we thank you for being on the program, because I'm not going to criticize you. But the next time you see a major drug come down in price, come back on the show and tell us how it happened. Alex Azar, thank you, sir. We appreciate you being here. Thank you.